Hello and welcome to the new 2022 Home Health Notice of Admission online video. During this video, we'll introduce you to the Notice of Admission, better known as the NOA. The NOA will replace the Request for Anticipated Payment, or RAP, effective on and after January 1st, 2022. Starting on and after January 1st, 2022, Medicare will require home health agencies to submit a one-time NOA instead of RAPs. This means that only one NOA is required for any series of home health periods of care beginning with the admission to home care and ending with discharge. Let's go over the changes. Please note that the following information applies to NOAs being entered using the FIST Direct Data Entry option. If you submit NOAs via the 837I format, additional fields are required. NOAs are submitted using Type of Bill 32A. You would submit Type of Bill 32D if you need to cancel the NOA. When reporting the statement covers period from to dates on the NOA, the date of the first visit provided in the admissions is reported as the from date. The to or through date on the NOA must always match the from date. This is in month, day, year format. The admission/start of care date must always match the date submitted as the from date. You can submit your NOAs when the HHA has obtained a verbal or written order from the physician that contains the services required for the initial visit, and the HHA has conducted an initial visit at the start of care. Again, as soon as the order is received, submit the NOA to establish the home health services on your patient's record. If you have patients receiving services in 2021 or prior and continue into 2022 under a new 30-day period of care, you will need to submit an NOA with a one-time artificial admission date corresponding to the from date of the first period of continuing care in 2022. For example, if a period of care begins December 13th, 2021 and ends January 11th, 2022, the NOA for the next 30-day period is submitted with the admission date of January 12th, 2022. Remember that only one NOA is required for any series of home health periods of care beginning with the admission to home care and ending with discharge. If you submit your NOA using electronic data interchange, additional data is required to satisfy transaction standards. For additional information about calendar year 2022 NOAs, refer to the Medicare Learning Network article MM12256. Also, watch for upcoming webinar information and educational materials that will soon be available. Thank you for participating in this video. If you have questions, please contact our Home Health and Hospice Provider Contact Center for assistance.